Today, the World Health Organization has taken a critical step in the fight against a new health threat. This decision comes after weeks of intense deliberation and mounting evidence of the severity of the situation. The organization has been closely monitoring the developments and has now decided to act decisively. Mpox, formerly known as monkeypox, has been declared a global public health emergency. This declaration is not made lightly and signifies the urgent need for international cooperation and swift action. The rebranding of the disease aims to reduce stigma and improve public awareness. As a new, more lethal strain spreads rapidly across Africa, the impact on local communities has been devastating, with healthcare systems struggling to cope. Efforts are now being ramped up to provide support, resources, and medical aid to the affected regions. The global community must come together to combat this threat and prevent further loss of life. In the Democratic Republic of the Congo alone, over 14,000 cases have been reported this year, highlighting the severity of the outbreak in this region. The bustling streets and crowded markets have become hotspots for the rapid spread of the virus, making containment efforts incredibly challenging for local authorities and healthcare workers. With a staggering 524 deaths, the impact on the community has been devastating. Hospitals are overwhelmed and medical staff are working around the clock to provide care and support to those affected. The lack of resources and protective gear further complicates their efforts, putting both patients and healthcare workers at risk. This new strain is 15 to 30 times more deadly than those we've seen before, posing a significant challenge for scientists and researchers. The virus's rapid mutation rate makes it difficult to develop effective treatments and vaccines, leaving the population vulnerable to its devastating effects, making it a severe threat not just for Africa but potentially for the entire world. The international community must come together to support the Democratic Republic of the Congo in its fight against this deadly virus. Collaborative efforts in research funding and resource allocation are crucial to prevent a global health crisis. The world is watching, and the time to act is now. The WHO's emergency declaration is a call to action, urging nations to collaborate on vaccines, treatments, and research. The goal? To prevent this virus from spilling over into neighboring countries and beyond. While the risk in the U.S. remains low, the CDC advises everyone to stay vigilant. It's important to be aware of the symptoms of Mpox, which include fever, muscle aches, swollen lymph nodes, and severe blistering. These symptoms can often be mistaken for other illnesses, so paying close attention to your health is essential. Early detection is crucial to controlling its spread, as it allows for timely medical intervention and reduces the risk of transmission to others. If you experience any of these symptoms, it's recommended to seek medical advice promptly. Additionally, practicing good hygiene such as regular hand washing and avoiding close contact with infected individuals can help prevent the spread of Mpox. Stay informed and take proactive steps to protect yourself and your community. Remember, vigilance and early action are key in managing public health threats. As we navigate this new global health challenge, the question remains, are we prepared to handle a virus more deadly than any we've encountered before? The world is watching. What will we do next? Please subscribe and follow at HealthNews.